Hello everyone, welcome to Move Well, Live Well. We get a number of people that are coming in here with issues regarding their ring, and pinky finger. These two fingers right here, they're getting numbing, tingling, weakness, gripping problems, sometimes burning sensation in through here. And what it is, it's a condition known as ulnar nerve entrapment. And what the heck is ulnar nerve entrapment? Well, the ulnar nerve comes out your neck, goes down the brachial plexus here into your arm, right in through here, your elbow, the cubital tunnel goes down your forearm right here and innervates the pinky and ring fingers. And so anywhere along that pathway, you can have entrapment of that nerve, giving you those symptoms. It could be here in the elbow, could be here in the wrist, could be in the hand, it could be up here in the neck. Well, how do you fix that? How do you fix ulnar nerve entrapment? You may have experienced it too, that ulnar nerve, it's also known as that kind of that funny bone. When you hit your elbow on a door or a chair or a table, oh, you get that zing sensation down into your pinky and ring fingers. That's the ulnar nerve you're hitting. Well, how do you fix that? How do you fix ulnar nerve entrapment? Well, there are 3 exercises that you can do to fix this, and they're I'm doing this in increasing intensity. The first one is the teacup raise stretch. You can also call it the owl stretch if you want. Well, the teacup raise stretch is this. So what you do, you take you're holding a teacup like this. And what you're doing is you're just doing this. See that? And you're you're just raising your ring and pinky finger backwards like that. So, whoop, see, it's like a teacup, whoop, just like that. Now, this could be very, very sensitive. So some folks, you just do that and you're already feeling some symptoms. Realize when you're doing these things, you want to do them as tolerated. In other words, you want to stay in the pain-free ranges as much as you can. Now, if you feel you're about right there and you feel a little bit, then you may have to back off a little bit and not go so far. So stay within those pain-free ranges into those ranges where you can kind of tolerate. And then over time, you can get more and more range as you do that. The teacup raise, and eventually you get to a point where you're looking like an owl like this. So the teacup raise stretch. Okay? So just in here, again, until you feel a little bit, again, to your tolerance. You don't want to be really painful or anything like that. And keep in those pain-free ranges, about 10 to 15 reps. That's it, 10 to 15 reps once a day. The next stretch is holding a tray stretch. So what the heck is holding? It's kind of like the T stretch, but you're holding the tray. So you have your whole hand flat and you're just doing this. You can even progress to rotate the tray. See that? Boom. So if you can get to this point where you're right here and this is comfortable after you do the teacup raise, and now you can do this, holding it here, you can do a rotation. See that? So this is holding the tray stretch. This is all kind of glide, ulnar nerve gliding or flossing. And essentially the idea is you're taking that nerve and you're allowing it to glide through these structures that may have adhered to it, and thereby, if it's adhered to it, it decreases the function of that, and that's why you get those symptoms that people are complaining about. So by doing these stretching, these nerve gliding, these nerve flossing, if you will, it helps free up that nerve along its pathway so that way it can function properly. So again, the second one is the tray. Once you get to here, this is good. And then you can do the boom. You can do the tray rotation. You can even do it down here. So you can go like this and you do the tray rotations down in here. And this is in this position as well. Just like that. If you're holding, let's say you're holding the tray this way. All right. Some folks, some waiters, servers hold the tray this way. And you hold it this way. And then you can rotate in here too. Boom. Just like that. And you can even combine both. You can combine both and go and do that. And you can make that cool noise too. So, and you can do that as well. So again, work up to that. The third one is a little more intense. So what you do is you have your palm up like this, and you have it up against the wall. So you have your palm flat against the wall. Now, a lot of folks, sometimes, again, these are things you work towards. This may be a stretch in and of itself, just kind of like, you know, gliding in and of itself, just right in here. It's like, oh, I already feel that. And work up to being able to flat palm the wall. See that? Work up to being able to flat palm the wall. Now, I don't have any ulnar nerve entrapment issues, but work up to this. And then once you get to be able to flat palm the wall, what you can do now is you tilt your head away from the involved side. And you can sometimes feel, again, working those pain-free ranges. Remember, 10 to 15 reps just once a day or so if this is really painful in through here. Right in there. Boom. I can feel that. Then you can even add, if that's okay, you can even add, you turn your head this way, see, to the right side, to the involved side, you bend your elbow, and then you straighten everything out, and then turn your head away. Woo! I can really feel that right there. Ooh, that's a good one. Again, you stay in relatively pain-free ranges you want to work in. Again, just 10 to 15 reps max in through here. See that? Boom. 10 to 15 reps max. Work up to these in increasing intensity, and ulnar nerve entrapment, cubital tunnel syndrome, gone. If you have any questions with this video, drop it off in the comment section below. We thank you for watching. We appreciate it. If you're new here, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button, because that'll keep you in the loop with subsequent videos coming here in the near future. And that way you can continue to move well, live well. Also, I know you know folks who may be experiencing ulnar nerve entrapment problems or ringing, tingling and burning and weakness into the ring and pinky fingers. Share this with them. They may have these issues. That way they're armed with the knowledge, so that way they can continue to move well, live well. So share this with them. Sharing is caring. Also, give us a thumbs up. It lets us know you care. Thanks for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.